Thrombosis is the formation or presence of a blood clot within the circulatory system. Blood clotting can be useful, as it prevents excessive blood loss when a blood vessel is injured, but clots can also form when they aren't needed and cause serious medical problems. Let's look at 3 such problems. In deep vein thrombosis, a clot forms in the calf or thigh as a result of stasis or slow blood flow. For example, in people who experience long periods of inactivity, or in response to inflammatory mediators from surgery, trauma, or infections. The clot can cause pain and swelling. If part of the clot breaks off into the bloodstream, it can end up lodging in the lungs. This is called a pulmonary embolism and can be life-threatening.
Okay, my name is Juliana Alvarado and I study in Universidad Católica de Santiago de Guayaquil. My topic is full study report of Andexanet Alfa for bleeding associated with factor XA inhibitors. Let's begin. Introduction. Factor XA inhibitors have a favorable benefit-risk profile for the treatment and prevention of thrombotic events, but may cause of worsen acute major bleeding with substantial morbidity and mortality. We have the application notes. This is right dose, right drugs, right road, right patients, and right time. Right drug. Nurse responsibility for medication administration includes ensuring that the right medication is properly drawn up in the correct dose and administered at the right time through the right route to the right patient. To limit or reduce the risk for administration errors, many hospitals employ a single-dose system. Right route. Some common routes include oral, intramuscular, intravenous, topical, or subcutaneous injection. In modern medicine, medication administration has become more complex with the development for drugs that can be given via never route, including but not limited to central venous catheter, patient control analgesia, epidural infusion, and intrathecal administration. Right time. Often certain drugs have specific intervals or window periods during which another dose should be given to maintain a therapeutic effect or level. A guiding principle of this right is that medication should be prescribed as closely to the time as possible. A nurse should not deviate from this time but more than half an hour to avoid consequences such as altering bioavailability or other chemical mechanisms. Right patient. Ascertaining that a patient being treatment is, in fact, the correct recipient from whom medication was prescribed. This is best practice by nurse directly asking a patient to provide his or her full name alone, checking medical wristband if appropriate for matching name and ID number as on chart. It is advisable not to address patient by first name or surname alone. In the event there are 2 or more patients with identical or similar name in a unit. Pros and cons. Pros. Rhombic complex concentrate are isolated from fresh frozen plasma and contains vitamin K dependent factors 2, 7, 9, and 10. Cons. Due to a limited number of patients in the control group, it is difficult to give a clear overview of the outcomes in efficacy between the PCC and the HPP. No treatment group. ISO applied in Ecuador. A tube of blood was drawn with sodium citrate for patients. The samples were processed in a CS 2100 system coagulometer. The sample was processed at 6, 18, and 24 hours. Result. Prior to calculations, all times were expected. In the analysis, there is statistically significant difference. In PT has 6, 18, and 24 hours, and the PVT was 18 hours. The anticoagulant patient showed a difference in PT, TDP, and INR at 18 hours. Using the graphic to explanation this topic in Spanish. Conclusion. It's important to every healthcare people to have caution with prescription and administration of this drug because it increases the coagulation factor in the patient. Thank you. Thank you to visit my video. Bye.
This is going to be a short video on anticoagulant drugs. In general, we're going to be talking about commonly used blood thinners. Anticoagulant drugs are commonly called blood thinners that are used for treating venous thromboses. So let's jump right into it. We're first going to talk about warfarin. Warfarin is by far the oldest of the drugs that we're going to be talking about. Warfarin is an inhibitor of vitamin K regeneration. Vitamin K is required to make some coagulation factors, such as factors 2, 7, 9, and 10. Vitamin K is also required to make protein CNS, which have an anticoagulative effect on the coagulation cascade. And if you apply warfarin, you will inhibit vitamin K regeneration, which thus prevents the making of all of these coagulation factors and protein CNS. If we look at the coagulation cascade here, the circled factors are the ones that are inhibited by warfarin. The circled factors are also the ones that are vitamin K dependent, meaning that if you don't have sufficient intake of vitamin K in your diet, or if it's not properly synthesized by your gut bacteria, the ones that are circled in red, are directly affected by, or not, maybe not directly affected, but they're certainly affected by warfarin. In addition, warfarin also requires bridging to use. Warfarin blocks this list of coagulation factors again. And of these coagulation factors, protein C is the one that runs out first. It's the one that has a short half-life and has a short concentration in the plasma, and those combined make protein C run out first.
Your doctor may prescribe NOACs, novel oral anticoagulants, if you have some types of atrial fibrillation, AF, or deep vein thrombosis. Your circulatory system is a network of blood vessels. Your heart uses these vessels to pump blood to your entire body. If you have AF, your heart twitches rather than pumping blood out fully. That means some blood may stay in your heart. Blood that isn't moving is likely to form clots. If clots are pumped out into your bloodstream, they can block a vessel, so blood can't get to your brain, leading to a stroke. NOACs, such as rivaroxaban and dabigatran, interrupt the clotting process. They prevent thrombin, which is a chemical that helps clots form from working or forming. This reduces the risk of life-threatening clots forming. If you receive a hard blow or deep cut, you may notice that you'll bruise more easily, and it will take longer for the cut to stop bleeding. Before you stop or change any medication, even if you're worried about side effects, talk to your GP first, as changing or missing a dose could harm your health.